ಲಿಮಿಟ್ ಮಾಡ್ಬೋದಾ? ಮಿನಿಮೈಸ್ ಮಾಡ್ಬೋದು ಇದನ್ನ. ಕಟ್ ಆಗುತ್ತೆ. Respected friends, wish you a very good morning. I think you're passing on to good afternoon also. Basically, I'm a Mysorean, and I should say I'm a proud Mysorean also. Those who are from outside, greetings from Mysore. The same Mysore palace, which was definitely beautiful, looks more beautiful in the evenings, particularly on those festival days, Saturdays, Sundays. So my philosophy is just make our own life as well as others' life beautiful with a little effort. I've been introduced by my good friend. Incidentally, I'm also a practitioner. I did my pediatric surgery or children's surgery almost 40 years back. I operate on poor people. In fact, that's my passion, I would say. Rich people, they can go to multinational or big hospital. They can get all the luxurious management treatment. But there are a lot of very poor people who have a problem of different types of surgical problems. They cannot afford to go there. And I'm happy to treat them because they have a sense of gratitude. And incidentally, many hobbies, probably I just highlighted about them. I always feel proud to be a teacher because many of us have heard the doctors manage only the diseases and sufferings. Engineers take care of the constructions. Lawyers take care of the law and order. Whereas teachers, they take care of everything. Teachers are the basic professionals who teach every professional. So I'm a proud teacher. I hope you also feel proud about your profession. Today's topic is youth and health. Being a teacher for about 39 years and a doctor for about 43 years, definitely concerned about the society. We teachers have a very high responsibility, particularly the youth. I'm sure when you go back to your younger days, so much of a change, physical changes to some extent, social changes, psychological changes, we see. The relationship between different people in the family, relationship between society, so much of a change. As teachers, we find a big challenge to take care of the youth, different aspects, the physical, the mental, social, or psychological and spiritual aspects. What is our responsibility? So we teachers have to mold the young generation for a great future of India. Let's see what are the problems, how we can manage those things. Infancy, by definition, starts from the time of birth up to 3 years. Early childhood is between 3 to 6 years. This is a time where the children starts going to the school. Late childhood is between 6 to 9 years. Adolescent and youth, which we are concerned right now. I'm extending a little more towards adolescence because adolescence is a very, very big challenge, not only to the teachers, not only to the family members, to the society, to everybody, even to the parents and others. Very big challenge. So adolescence is 9 to 14 years. Up to 19 years is late adolescence. And the middle part of this, 12 to 16 years, is a very complex situation in all aspects. Youth, what we are talking about now, is 19 years onwards. Old age, I don't think we need to bother about it, but some aspects of it, because we probably stand, at least some of us stand in the other side of the table to manage the situation. So our own health, our own behavior, our own commitments also have to be taken care of. Old age is 65 years. Young old is 65 to 75. Old age is 75 years onwards. It's a very complex issue. The whole life, right from the time of birth up to old age, is a very complex. The children have fascinations. They are confused. They appear to be happy. The parents and the teachers have to mold them to a right track to become good and great citizens. I'm touching a few components of the importance of adolescence because that's the one which leads to the youth. Is a lengthy transition state, 6 to 8 years, 10 years, which may last a decade or more, 10 years or more, is a distinctive period in which an youngster is no longer a child, nor yet is fully an adult, something between childhood and adulthood, but partakes in some of the challenges, gets the privileges or expects the privileges and expectations of both epochs. Youngsters reach physical and sexual maturity before they are cognitively and emotionally mature. So physical and sexual maturity is earlier than their cognitive and emotional maturity. Basic thing here we have to understand is how to impress our own students and youngsters is their mind is extremely important. A healthy mind in a healthy body is extremely important. A unhealthy mind, diseased mind, all the bodily functions alter, the social and spiritual functions also alter. So it's very important to keep the mind in a very healthy situation. Intelligence, we have different grades or different types. Linguistic intelligence regarding the language and other communications. Mathematical or logical intelligence. Musical, it is in some situations. Visual or spatial intelligence. Physical, inter and intrapersonal intelligence. Each one of them has its own role to play. As and when we go, we'll try to analyze this. There was a small joke. Belt is very good. Tying a belt is extremely good. You can see that the driver has put it on across, not across the trunk, but across the mouth to make her comfortable, or maybe he is so uncomfortable. Adolescence, impulsiveness is there, mood swings are there. We come across a lot of mood disorders in our hospital. Poor judgment because of incomplete knowledge and inability to take the decisions. Second wave of growth and pruning occurs, making the brain more efficient. First, maybe 3 to 6 years or maximum 10 years. Second stage during adolescence and later adolescence. So there is a continuous change in the brain, in the functions of the brain also. Limbic areas is a functional part of the brain, matures faster than frontal lobes, which are concerned with the different aspects of our day-to-day activities, which are involved in judgment, reasoning, and organization. So different aspects of these go on changing, plasticity, what we call. And during this period of adolescence, childhood to adolescence and youth, is our responsibility as teachers as well as parents to see that the child or the young fellow is encouraged or molded in the right path. During adolescence, there is physical growth, which is quite evident and important. Emotional and psychological. Yes, this is very, very important. This is what we see a lot of changes in the adolescent and young adults. Social aspects. It may be intra or interpersonal relationship with other people in the society. And in the beginning of this adolescence, gender issues, because the boy or a girl becomes an young adult, adolescent. Reproductive system changes in all aspects of the reproductive system. Sexuality starts its introduction during this adolescence. They are confused, they are having incomplete knowledge. So it's our duty to see that they get the right information. So you can see the children there, they are thinking that everything appears to be okay. Young adults, adolescents, yes. We come across a lot of these situations in different media, different situations. There's a lot of confusion. That's what we see in the society. So they think the physical and mental and all those things are related to each other. They do not know what actually is happening. So they are in a state of confusion. Nature and nurture. Yes, this is another important aspect that we need to understand and educate. Nature, the one surrounding us, it may be society, it may be the other aspects of the nature, and how this is influencing the children, adolescents, and adults also has to be monitored and guided. Whenever there is a confusion, there is a problem, they have to be put into the right track. So this is a very important aspect that we need to understand. What we nurture, that's what it looks like a brain. More into the love, sex, and other things, the things change. So a young boy has to be guided in the proper line according to the age and the future expectations in the right pathway. You'll be surprised that the brain, which is a part of the nervous system, is the first system in our body to develop during the embryonic period. Embryonic period means from the time of conception, beginning of pregnancy, up to 2 months, approximately 2 months, the different organs start developing. Almost all the organs are almost to a particular status by the end of 2 months. 2 months to 9 months, we call it as a fetus, where increase in size, increase in complexity, functional changes occur. So 2 months, 0 to 2 months is a very crucial period. Of all these different systems like a skeletal system, muscular system, nervous system, digestive system, like this 1 dozen system, the nervous system happens to be the number one because that is going to take care of the full growth and development and coordinations of all the organs, all the systems. So it has to be given first priority. As early as 3 weeks of embryonic life, you'll be surprised the size of the embryo, the first 2 months, we call it as embryo, is hardly about the size of a stapler pin, 3 to 4 millimeters, that's all, 4 to 5 millimeters maximum. In that, the first system to start developing is the nervous system. And the number of cells multiplying and forming new cells is 250,000 cells per minute. You can understand how rapidly the nervous system and the brain is trying to increase and coordinate all the activities. But there are more than 100 billion neurons, particularly in the brain and spinal cord. And almost every cell, what we call as a neuron, is connected to the other. There is a speciality of the nervous system. 10,000 connections at the time of birth, all those 100 billion. And it's a continuous process. Throughout our life, we have these connections and disconnections. So in the bottom, you can see that 11 weeks during 3 months, fetus, already major portion of the brain and spinal cord have developed. By about 7 months, the whole brain, functioning brain has developed. And at the time of birth is completely developed to that particular age. And almost up to maybe 20, 25 years, further specialization, further connections, particular connections are very important, take place up to 20, 25, 30 years. So brain is a very complex organ. It controls all the activities. It's not just walking around, the muscle contraction and all that. Every millimeter of the body is controlled by the brain. There are millions and millions, trillions, I would say, of connections to every millimeter of the body. There is no part of our body which does not have a connection, nervous connection to the brain, including the what we call as the higher functions, like the anxiety, like the anger, the depressions, the happiness, the sleepiness, everything, literally everything. And the funniest thing is, the nerve cells or the neurons, they are like chargeable batteries. And millions of connections, trillions of connections, and the speed at which they work is not even a fraction of a second, millionth of a second. Millions of neurons get connected. Even our computer may be slow, but this is more than a supercomputer. Every part is connected 24 hours a day. It gets information from outside. It may be touch sensation, pressure sensation, pain, temperature, vibration, or special sensations from the eye regarding the sight. There is a light, intensity of light, color of light, sound sensation, smell sensation from the nose, hearing, balance. All these sensations are reaching the brain 24 hours a day. Majority of them are being stored or recorded, and a new information, if already recording is there, memory is there, compared, decisions are taken. All this happens in a fraction of a second. Unbelievable. And there is always a plasticity. Plasticity is continuous modulation or change. Some things may be stopped, deleted, new things are added up. So there's a continuous link throughout our life, even the last day of our life. So continuously there is a change. It's nothing like a 25 to 30 years we have learned and there's the end of it. No, continuously we will be learning, and brain also changes both in its structure and function, particularly function. New connections are formed. I'll tell you a few important things about Albert Einstein, why his brain was considered something of a genius. So every part, every system, digestive, cardiovascular, reproductive systems, every system is very perfectly coordinated by this supercomputer. So as we developed during evolution from a amoeba, maybe from a fish to frogs and this, new parts of the brain developed. For example, reptiles, the crocodiles, the snakes and all that had a limited type of a structure and function of the brain. Later, the mammals, different types of mammals started, new types of brain, new connections, new functions started. As on today, new mammalian, new, the present one. And it's not going to stop. Maybe 1 million years later, if somebody is sitting here and talking to other teachers, there may be further changes in the brain, the structure and function. Continuously, it is being modulated. So a lot of studies, there are thousands and thousands of scientists throughout the world studying the different aspects. In fact, we make a joke, even though we know so many things about our human body, different aspects, different systems. If you ask me a question, how much of brain or nervous system you know, I'll feel ashamed to say not even 50%. 50% of the nervous system, function, structure, we know. So much of a complex, so many things that we thought is this one suddenly changes due to research. So such a complex brain. So different parts of the brain, what we thought about 25 years back, this is the part, this is the work it does, suddenly changes due to a new research outcome. But whatever, basic things are always there. A lot of research work is being done throughout, because it's a complex organ. It just cannot be seen. It's more of a functional organ rather than, whereas, for example, stomach or intestine, liver, and all that, we can literally see there. Here, nothing there. They're all high speed connections of different trillion neurons, more than a billion, and all of them working simultaneously, getting connections. So every part has got a very specific role to play in its work. All these things every day we see this. Two school boys have a bloody fight over a girl. Very sad. So it's our responsibility to talk to them, counsel them, explain to them their situation, their life, their health, everything. Every day we are seeing all these things. Lot of influence by the society, lot of influence by the bad people, I would say. Every boy is stressed more than the physical mental stresses. So whole brain, every millimeter, fraction of a millimeter has been is being studied, mapping of the brain, what we call. And every part has got a specific function, but it is connected to every other part of the brain as well as the corresponding part of the human body. Very, very complex. Yes. A few words about our Albert Einstein. Yes, there are changes, look similar, but different. Yes. The information that we have, maybe a little exaggeration, I would say. Why is Albert Einstein's brain considered as something great, something very special? Did he have a big brain, or did he have more number of nerve cells or the neurons in his brain? Even today, his brain is being analyzed in the neurology laboratory. When they looked into the brain after his death and took out the brain and started studying, it was a really a surprise shock that his brain is the same size as any other common man. Please note this, ordinary common man, not even the brain of some great scientist or a great doctor or some genius. No, it was a size of an ordinary common man. And the function was almost like any other person. Then why was he great? Why was he considered as a genius? What was special about him? A lot of studies have been done. A lot of studies are still going on to understand what is special about it, how we can understand this brain and functions, how we can adopt that system into our own brains. Two important components have come out, very important components have come out after the study of the brain. The two components are very, very simple, logical. For example, we have a bicycle, we have a machine, we have a scooter, a car. When you are using it regularly every day in a very organized way, it will be in a good condition. The machine will be in a good condition. Here and there, small little problems, lubricate it, put an oil, take care of the small little repairs. It goes for years and years and years. Same thing. Albert Einstein used to look at a particular problem from different angles. All of us look into this particular problem. This is a cancer. Oh, this is a cancer. This is what cancer cell or cancer tumor looks like. But Einstein used to look from many angles. Yes, this is a cancer. Why this is the color of a particular brownish color? Are the different parts of the cancer same? Are they different? And how this has started. So from a different angles, when he started analyzing, different areas of the brain became active. And the different areas of the brain got interconnected and information went on in a geometric proportion. So this was is probably a simple logic of intelligence, analyzing from different angle, multi-pronged approach. Second thing that we see is whenever you keep a machine in a good condition, we lubricate it with oil, we clean it, we maintain the thing with small little repairs and all that. Same thing happens with our body in general and mind in particular, or brain in particular. When you use your brain more and more, it needs or demands oxygen and nutrients. So naturally, the blood on a priority basis, controlled by brain itself actually, more blood goes into the brain, more oxygen is supplied, more nutrients are supplied, the carbon dioxide and other waste materials will be removed. The surprising fact in everyone's body is the amount of oxygen that we consume into our body, 25 to 30% of it goes to brain. Remaining 70% has to be distributed or shared by other organs in the body, whole body. Brain itself takes nearly 1/3 of the oxygen, even almost equivalent amount of nutrients also, indicating that this needs a lot of energy, lot of oxygen, lot of work. So we can practice that. Use brain more and more, more and more. Look at the problem from different angles, analyze it, discuss with friends, come to a conclusion, question that conclusion. So same thing was being done by Albert Einstein. This is simple logic how an ordinary looking brain, a small, medium-sized brain, was a brain of a genius. I always tell my students, why don't you try this? Show something, each student is going to tell something about it. I show you a heart, for example. Pick a dog, like carry the heart, a plastinated heart, a dry heart. Show it to them. What is this? Please do not answer. Raise your hand. I'll ask who is that person because we are interested in analyzing this situation. So one boy says it's a heart. Yes, thank you. Good. Congrats. I ask another one. Don't say tell the same answer. I want a different answer. Probably is a human heart, sir. Very good. Very good. Some other girl raises the answer. So it's adult heart, sir. See, from a different perspective, a different order, different angle, the same information or the situation is being analyzed by different means. So that's what we have to practice. Once you do that, the memory centers in the brain become alert. Lot of information gets into the brain, and they can always be called back, utilized in our day-to-day situations. Many other students always ask me, sir, so much to read. I don't think there is so much of a space in our brain. I tell them a simple physiology information after a experiment. Your mobile, after some information being stored and all that, at one stage it says memory full, delete some files. Your computer also does the same thing. So they experimented how much is the memory space in our brain. When they did this, it was a very nice surprise that theoretically at least for a short period of time, they recorded the different types of input information, a sight, video, or a sound recording, maybe taste and smell, touch sensations, others, 24 hours a day for a short period of time. And they extrapolated it to long time, how much of a space it can occupy. It was decided, it was found out that 200 years, 24 hours a day, record information, anytime, sound, light, taste, smell, touch, whatever, to the brain. At the end of 200 years, cross-check how much of a memory space is full, how much is vacant. It was surprised that not even 75%, 200 years, none of us can stay alive for 200 years. So 100 years, more than 50% is available. So I tell my students, so much of a space is there, you don't need to feel that there is no space. One thing is you have to put it in an order so that you can get it back. It's as simple as keeping something in the cupboard and remembering it whenever you want, within a second you can get it back. So the type of a system we have to teach our youngsters. Women have a smaller brain, but they use them better than men. Yes, this is interesting. All the women and girls become very happy when you tell this sentence. Oh, about 15 to 20% smaller compared to the man's brain. Man may have anywhere between 1,200 to 1,500 grams, 1.25 or 1.5 kgs of brain, about 10 to 15% smaller. I always do a small experiment whenever I give a talk about this particular aspect of the brain. I ask a boy, just a thing, whatever comes to my mind. Can you please help me? Yes, sir, sure, sir. I want to just go outside. I have something forgotten in my car. Can you please accompany me? I want to bring that and show it to all the students. He says, yes, why not? He literally comes out. Please come, sir, I will help you out. Is it very heavy? No, no, it's not very heavy. I want somebody to hold that. I tell them, please sit down. Please sit down. One more thing is there before we go. I call out a girl randomly. I repeat the same sentence. I have something in the car. I want to show this group of students. Can you please come down? The response is totally different. The girl looks this side and that side. His own neighbors, classmates. She thinks over. Should I go or should I not go? Then sometimes she also discusses with the next candidate, maybe a girl or a boy. He's telling like this, should I go? Is there any risk of going with him to his car? Is it worth it? Why he has pointed out me only? Why not others? So many questions. So the purpose here is a situation immediately is taken up, believed, boys just say, okay, sir, we'll do it. Whereas same thing in a female brain, which has got higher number of connections, much more number of connections in different areas. That's why when the same question is asked to a woman or a female brain, it says it has to analyze before taking a decision. And at the end, it may even say that I have to discuss with my parents, my mother, whether I should go with you to get it. That. Can I call my family members? Yes. It is only to show the comparison between male and the female brains. It's got different areas, just like our computer also has got different areas. The hard disk also has got different sectors. The right hemisphere, left hemisphere is half of the brain, has got different functions also. The right one, for example, music, regarding the music and art and dance and all funny things, arts and crafts. Whereas the left one has got a more logical way, the language, the mathematics and writing, so many things. So even the brain is organized for various functions so that there will not be any confusion, there will not be any blockade of these functions. The brain also has three modes of learning. We can highlight on this thing to the students for different types of learning, which is better and how each one can supplement and complement to the others. Seeing, visual learning, yes, this is one of the best things. Hearing is a very short term, may not be very efficient also, but doing is the kinesthetic one, is the excellent one. And the students, as we are studying, sir, we are very honestly reading and all that, but somehow we are unable to recall, or memory appears to be a little confused. I say that you hear something, you'll remember. Like a song. First time you like the song, very melodious. Second time you hear some of the words become familiar, the lyrics become familiar. Third time, fourth time, you almost know the whole song. You can sing. But you do not know the meaning if it's a different language. But you will see the video of the same thing, you learn a lot, you never forget it. And you yourself sing a song, have a dance with you. So multiple ways of input to the brain, learning becomes better and is a long term also. So try to put in the effort to both right brain and the left brain so that they complement with each other. The research areas in this of learning, different aspects. I told you the nature, nurture, sexual behavior, changes that occur during adolescence. All these we have to highlight. The male brain, specific areas are always active. They take a decision. Different names are there. Let's not go into the technical details. We don't need that. Different areas are coordinating with each other. It all depends on how well you have put the input and recorded. And equally simple, the output also comes. So different areas have been allocated for different types of functions, cognitions or emotions or motor functions and the sexual functions, different areas, so that they will be more efficient. Just like in office, we have different case workers. Female brain also is similar, almost similar, but more of connections. That's why it takes a little longer time to take a decision, and sometimes it says confused because too many things are going on. So areas are almost simple, but some overlapping is there. Lot of discussions and finalization of the effort is there. So changes in the male and the female brains have got their own role to play. The psychological, social aspects also come into play here. There's a lot of questions we try to understand in research, why men lie and women cry, the emotional aspect, the social aspects. A lot of books are available nowadays on small little aspects. A big book has been written. When men don't listen, women can't read maps, and why men don't iron their clothes, things like that. A lot of very interesting. What men should understand about women and what women should understand about men. A lot of interpersonal aspects to have a good family life, a colleague's life. Yes, this is another interesting aspect that we have come across in our brain research or psychological research. The range of vision of a male looks like our tongue or horse. Very specific, looking at it and trying to, it doesn't even bother what's happening on either side. Very narrow vision, sometimes we say. As a woman, maybe because of the anxiety, because of the fear, because of non-belief in others, has a longer range, wider range, and she every second she's always a little tension. Anything can go wrong with her and all that. So she's got a larger or a broader vision. So you can understand how you're hidden the butter from me again. He has closed eyes. How can he see the butter? There's so much of a butter. So we have our own narrow-mindedness, and we try to put the blame on others. Whereas women are much more smarter. It is nowadays I see they are much more smarter. When she hits a tree and the police trying to explain to her that she has met with an accident, she smartly says that navigation system has cracked. It's not my fault. I was trying to follow that. So see the expressions, facial expressions by a man and a woman. In the top, men. Look into this from left to right, not much of a change at all, whether it's a sadness or a surprise, anger, joy, fear, almost the same face. See the same thing in the woman, so much of a change in the expressions, the facial sizes, the mouth, the tongue and the teeth and the eyes opening, closing, the eyebrows, so much of a change. So she analyzes or opens up more number of areas. The communications, the facial expressions are so different. So much of change occurs during this adolescence and early youth stages. All these we come across in different situations, different students, whether it's a UG student or a PG student, or even high school students, we find a lot of things. I go to a lot of schools to educate about their physical, psychological, and sexual changes that occur adolescence. So a lot of issues. When I ask them to have any questions they would like to ask, a lot of students hesitate, and one of them starts, the other girls start. And many of them, I give their number. You can call me. I get a lot of phone calls, a lot of confusion, a lot of curiosities, and these things. So, a lot of situations we come across. If you think sex education is dangerous, ignorance is more dangerous, right? So, sex education done in a proper way has got its own importance, because incomplete information is there, confused information is there in the society. The right type of information is not, and a lot of this media, even this WhatsApp or other messages give a wrong information. That is very, very dangerous also. So these adolescents and youth, they have to be given a correct authoritative information, particularly because it involves the psychology and sexology. So schools, a lot of pros and cons and yes and no's for sex educations in the schools. But as medical people and as people concerned about their adolescents, we definitely vote. They have to be given in an authoritative way by a competent teacher or a competent person. Yes, there's a nice way one of my friends told me. Everybody has got a stress. Stress management is a very big challenge, and we have to practice. That as teachers and the seniors, is our responsibility to practice stress management. Yes. When wife is pregnant, naturally till she delivers, normal delivery, baby is all right. Husband is always in stress. He's got responsibility of the office and other managements. Yes. Anxiety. He becomes anxious when the girlfriend is pregnant. You can understand the logic here. He becomes panic. He doesn't know what to do when both of them are pregnant. Whom to blame now? Depression tragedy. This is the worst part of it. When you are not responsible for either of them. Yes, all these things are happening every day. We come across different types of situation. Particularly we doctors in the hospital literally see all these things every day in different types of societies: poor, rich, educated, uneducated, city dwelling, village, all categories, men and women, everything. So anxiety is a very important thing. We have to understand the anxiety, control the anxiety. There's no other. There are lots of reasons for the death, early death. Nowadays, we are coming across heart attacks in the 20s and 30s, cancers in the earlier stages. At the time of birth, I've seen a cancer of the kidney. I've operated also kidney cancer, Wilms tumor. Lot of blood cancers we are seeing in the childhood days. Lot of stomach cancers, lot of pancreatic cancers is increasing. Women, I operate also in my clinic under local anesthesia. I come across a lot of 18, 20, 25 years girls coming with the tumors in the breast. So a few basic investigations, if they turn out to be non-cancerous, I'm happy more than them. I expected it. Absolutely nothing to worry. I will operate and remove it without causing any pain under local anesthesia. Removed, that's the end of it. Whole thing is come back to me once in 2 to 3 months to find out whether new one has started. But also come across a lot of cancer cases, cancer of the breast, cancer of the uterus, cervix, a lot of the 20s and 30s. Very, very sad. And I always tell them, early stages, even cancer is curable. I have many examples where I have operated on cancers, purely proved cancers, 25 years, 35 years back. Even today, they are alive. Once it spreads to all the parts of the body, nothing can be done. Whatever chemotherapy, surgeries, nothing is going to work. We have to educate people, particularly students, families, educated and uneducated, regarding the early report to the medical profession or doctors or the hospital. No fear, no anxieties. Let them get the right treatment. They get cured any disease. See the cardiovascular system, number one in the whole country. Cancers are equally there. Very unfortunately, the psychiatric disorders are increasing nowadays. Depressions, different types of psychological disorders, psychiatric disorders are increasing nowadays because of the lifestyle changes and other things. Diabetes is increasing. India is becoming number one in diabetes. America, some of the Middle East countries, some of the European countries, Japan were in the top. Now, India's obesity, yes, very big problem. Childhood obesity is also increasing nowadays. Yes. See this person eating and sitting, sitting and eating. Women in no way inferior. See there. It leads to all types of complications. Obesity leads to diabetes. It leads to hypertension, high blood pressure, leads to joint pain, muscular weaknesses, neuromuscular problems, including cancers. So we have to educate people regarding their lifestyle, regarding their food habits, regarding exercise, everything. See this, children, obesity in children is increasing nowadays. They just go on eating. Parents cannot control, they may not be even available at home. Children are taken care of by the ayahs or somebody at home, maybe grandparents. So they go on eating, some stubbornity, small family, nuclear family. So we come across a lot of children having obesity. This is the problem. They go on, I don't know what they're watching. They're watching TV or something else and hand to mouth. They don't even know how much they've eaten. Yes. So because of this, fat levels in the blood is increasing. We are coming across people, even educated people, dying of a heart attack at the age of 20s, 25s, 30s. Cholesterol deposits. Every day in every cardiology or cardiac surgery departments, a lot of stents, cardiac surgeries, CABGs are going on, increasing. This is bypass surgery. All this could have been prevented. A lot of issues in the women, abdominal problems, heart problems, a lot of them. See this, cancer of the ovary, yes, ovarian cancer, thyroid cancer. They're all increasing. When we were students 40 years back, we literally used to search for some diseases, some cancers. Nowadays, almost every 15 days to 1 month, we are seeing every type of cancer. Very unfortunate. See on the left side is the uterus, on the right side is the urinary bladder. The uterine cervix cancer has spread to the urinary bladder also. Very unfortunate. Before it spread, if it was operated, the lady would have been totally fine, but it's very difficult now. Ovary, the one which produces eggs. Yes, smoking. Very unfortunately, whatever bans you're doing on smoking, still a lot of issues are there regarding the smoking. Not only lung cancer, stomach cancer, liver cancer, so many cancers. 90% of the lung cancer due to smoking. There's active smoking. Passive smoking, the air that they have brought out, inhaled again by the other people, 65% passive. Anybody, men or women, children, anybody can have this. Alcohol is another very big challenge for us. A lot of diseases starting from a gastric ulcer to dangerous liver damages, cirrhosis of liver, cancer of liver, pancreatic cancers. So it's our duty. See the difference between the lung, normal lung on the left side, and the damaged lung due to air pollution and smoking, cancerous lung. So breast cancer is almost becoming number one or number two in women. We tell them, don't hesitate, don't feel shy, don't every day you take bath at least twice a week. Touch your breast, examine your breast with your fingers. Any slightest pain, any slightest small lump there, immediately go to a doctor. We have got wonderful investigation, mammography, 2 millimeter sized tumor can be identified, and we operate 100% cured. I have operated a lot of such things. People neglect. See the stomach cancer due to smoking, due to spicy food, due to alcohol. So food control is extremely important. Brain cancers are increasing. We never heard of a brain cancer in our studies 40, 45 years back. It was only a theory, but we see a lot of, one of my classmates is a neurosurgeon. He says every week, 2 to 3 brain cancers is operating. Very shocking one. Liver cancer due to virus hepatitis, due to alcohol, principally. Junk food, yes, another one. So ovarian cyst, where myself and my professor had operated. Ovary is a small uh, almond shaped, about hardly 1 inch by 1.5 inches. This is 15 kgs. It's becoming. Luckily, it was not a cancerous one. It was a non-cancerous tumor. So only 78 women will be diagnosed with ovarian cancer in their lifetime. A lot of ovarian cancers we are seeing. The most unfortunate thing about this cancer, I should tell, is from the time of starting of the cancer till almost 70-80% of the progress, it does not cause any problem. That is the biggest unfortunate problem that we come across. No pain, no discomfort, nothing at all. Chronic, goes for years together, months together. Very unfortunately, one day they start getting everything together. They lose weight, they have, depending upon the organ, the blood in the motion, blood in the vomiting, blood in the sputum, loss of weight, high fevers, uncontrolled conditions. When we diagnose, probably it's too late. The cancer has spread to every part of the body. So people should realize slightest change in their daily routine, any discomfort or pain, anything, or a tumor somewhere, instead of saying that nothing is going to happen, it's been there since my childhood days. Yes, it can turn out to be a cancer anytime. Only yesterday, a small girl about 22 years or so had a small black mole, this Tibeto. When I asked her how long is there, she said since my birth. Now is 22 years. What made you come? It's increasing nowadays. I was shocked. I literally removed it with a normal skin also. I sent it for a biopsy. So 22 years has been there. Luckily, a college student, she had some education about cancers. She immediately came to me and said, please do something about it. Under local anesthesia, I removed it because now it started increasing. We don't know, it might be turning to cancer. Luckily, it's been completely removed. No pieces left. She'll be all right. And the report definitely issue is going to come either as a non-cancer or even early stage of cancer. Tumors like this, lot of tumors we come across. Yesterday, I operated on 3 more people, all these tumors. Anyway, I feel sad, even though I feel happy that I could do something to the society. I charge very, very little. I don't take my charges, no surgeon charges. Only materials I utilize for those few hundreds, 300-400, that's all. All cancers also I operate. See the blood cancer, number of cells have increased, they have become abnormal. Leukemia, blood cancers. So it's our duty to see that we maintain our health. By definition, physical, mental, social, spiritual, everything, every aspect of our. And as teachers, is our responsibility to see that we transfer this basic knowledge about our health to our students, particularly through the students to the society, their family members and society. Everything is excellent. Life is excellent. Society is excellent. It's up to us to take care of it in the right way. Such education, lot of confusions, lot of discussions against, for, lot of things are there. But I, as a doctor, say a proper education about sex in the adolescent period by a qualified specialist, the right things to know is always safer than going in a wrong way. If you do not educate, they try to get the information through somebody else. Yes. The understanding between men and women, lot of understanding. Women think my boyfriend, my husband should be like this, somebody great, internationally reputed. So that's what they feel. All the girls look at men from different angles. They have their own, sometimes very funny expectations. Yes. All these have been done as a study in the psychology department and psychiatry departments. A lot of studies. Strongest guy in the world should be my boyfriend or the husband. Yes. Yes. Concerns of female. All these different aspects. Yeah, men are equally concerned about women. So they want different aspects of it. They look into the 50 plus people there. Men have got their own, yes, they want a great lady, heroine, different plus, plus, plus. So a lot of expectations, a lot of confusions, a lot of, yes, men and women, they have got their own expectations also. Yes, nobody likes these things. These people like this, though they go on eating, they become obese. And very difficult to come back also. So wrong information about the sexual education. A lot of misconceptions. Right from the childhood days, the development goes on. A lot of changes occur. We find the intersex. A lot of genital reproductive system birth defects. We operate and correct it. Yes. Couple seek divorce after 48 years of their married life. Looks ridiculous. Understanding, social, psychological, yes, all these things we see. So changes in the male and the female hormone has got a very important role after the adolescence. Not only the physical component of the sex, but also the psychological and social component of the sex. It is our duty as seniors and teachers and doctors to educate them, tell them the priorities, and put them into the right track. Yes. See, the fellow is going with his wife, but looking at somebody else. And there is always a perfect fight in the world, and every neighbor has it. See this one. Each neighbor is looking at the neighbor's wife. Yes. All this, particularly media has a very high important role to play. Yes. Lot of confusions, lot of tensions, lot of anxieties. We see women voting men, men voting women. Yes, women having so much of a work. Maybe she's working, work at home, multi-talented, multi-faceted. Men try to do it, but they are in a state of confusion. They cannot get scolded, inefficiency. Yes, marriages, roses, roses all the way. But how much, in what situation, we do not know. Yes, a orthodox family, a understanding family may go on, but how long we do not know. Any time, anything can go wrong. Open marriages, closed marriages, arranged marriages, love marriages, so much of changes are there. Each one has its own advantages and disadvantages. Yes, every person has his own knowledge, his own view of the situations. Recommended sex education for schools and college students. A lot of discussions are there. Not people are against it also, but we always explain to them saying that if you do not give a proper, correct education, there's high possibility of these fellows trying to, out of curiosity, trying to go in a wrong way and learning bad things. Yes, from a toilet, from urine or stools. No, absolutely no. Unless you are done for fun. Yes. So if you do not educate in a proper way, they can always go in a wrong way. Lot of values related to sexuality is all natural and healthy things. Different aspects of it to be educated. Sex education itself is a big chapter. You can invite the specialist and see that students get the right information. Correct way of communication has to be done. Interpersonal communications has to be done. Understanding has to be done. So proper, good, healthy family, the parent and the child relationships, a big joint family, parents, grandparents, children, grandchildren is all missing nowadays. Affections between the family members is decreasing. More of a money-mindedness, the egos, super egos, all of them have taken away our good family relationships. Yes. Lot of chemicals are there in the brain for different activities. Changes in the chemical lead to a lot of psychosocial problems or reproductive system problem. Luckily, we have got wonderful medicine, even for depression. We got wonderful medicines. Counseling is necessary. Lifestyle changes are necessary. Food consumptions have to be altered. Then necessary drugs, if necessary, are given. They become totally all right within a few weeks or few months. Once upon a time, going to a psychiatrist was thought as a mental patient and all that. Now, a lot of people come to the hospital and we treat them, we follow up them, and they become all right. So, we did a lot of work on depression because depression is increasing nowadays due to a lot of reasons, right from the childhood up to old age. They commit suicide, they go for depression, they lose their job, they lose their education. So we collected the brains from people who died of depression and we analyzed it. These are the deep freezers, minus 80 temperature deep freezers. And luckily we were able to analyze a lot of things. It's not the social factor though, it's the psychological, which is due to changes in the brain. A lot of aspects of the brain we did. So we come across a lot of issues like changes in the brain chemistry, neurotransmitter, changes in the cells. All that is curable now. Talk to them. We analyzed it even before the depression starts, before even early stages of depression. We can analyze the blood. We can go for a CT scan of the brain. So a lot of patients are being treated. Our role was only to prevent a depression, prevent a suicide. Yes. So luckily, because of all these commitments of mine, I had the privilege of getting some awards and all that, more than 200 awards as of today. And a lot of children come to our museum to learn about the different aspects of the health, and they're all welcome. We don't charge them. So healthy balanced diet is an extremely important one. I hope I've made things clear. As teachers is your responsibility because the student spends a lot of time in the college or the outside their house, and they are the future of our country. And we have to see that they are in the right track. They are the future power of our nation. Any doubts or any questions or clarifications, even suggestions, most welcome. Thank you very much. You can always note down my mail address or the contact numbers. I'll be too happy to clarify. Both the numbers will be always on, except when I'm giving a talk or driving, they may be switched off or I may not be able to answer. Otherwise, from my side, any help of any kind, I'll be too happy to do it. And again, I thank this organization and all the teachers who are listening. A great future. Sarve Jana Sukhino Bhavantu. And we as teachers, let's make the society much better. Thank you so much.
So myself, Dr. Nagesham, working as assistant professor at Central Tribal University of Andhra Pradesh.
Your subject, sir?
So my subject is social work.
Social, very nice, sir. Very nice.
Social work. So ನಾನು ಅದರಲ್ಲಿ ವರ್ಕ್ ಮಾಡ್ತಾ ಇರುವಂತದ್ದು.
Nice, very
ಸರ್
nice.
ಈಗ ಈಗಿನ ಕಾನ್ಸೆಪ್ಟ್ ಅಲ್ಲಿ ನಾವು ನೋಡೋದಾದ್ರೆ ಐ ಥಿಂಕ್ ಕಾರ್ಪೊರೇಟ್ ಕಲ್ಚರ್ ಅಲ್ಲಿ ನಾವು ನೋಡೋದಾದ್ರೆ
Yes, sir.
ಇತ್ತೀಚಿನಲ್ಲಿ ಸೊ ಇಟ್ ಇಸ್ ಅ ಪ್ರಾಕ್ಟೀಸ್ ಲೈಕ್ ಮ್ಯಾರೇಜ್ ಅನ್ನೋದು ಸೇಕ್ರೆಡ್ ಅನ್ನುವಂಥದ್ದನ್ನು ನಾವು ಯಾವಾಗ್ಲಿಂದನೂ ಹಿಂದೂ ನಮ್ಮ ಕಲ್ಚರ್ ಅಲ್ಲಿ ನಾವು ನೋಡೋದಾದ್ರೆ.
Yes.
ಸೊ ಈಗ ಪ್ರಾಕ್ಟೀಸ್ ಆಫ್ ವೈಫ್ ಸ್ವಾಪಿಂಗ್ ಅನ್ನುವಂಥ ಕಾನ್ಸೆಪ್ಟ್ ಇದೆ.
ಹೌದು.
ಹೈಯರ್ ಲೆವೆಲ್ ಆಫ್ ಏನೋ ಕಾರ್ಪೊರೇಟ್ ಕಲ್ಚರ್ ಇದು.
Yes, yes.
ವೈಫ್ ಸ್ವಾಪಿಂಗ್ ಅನ್ನುವಂತಹ ಕಲ್ಚರ್ ಈಗ ಏನೋ ಚಾಲ್ತಿಯಲ್ಲಿ ಇರುವಂತದ್ದು.
Increasing also.
ಇಟ್ ಇಸ್ ಸರ್. ಈಗ ಏನ್ ಎಕ್ಸ್ಚೇಂಜ್ ಹಸ್ಬೆಂಡ್ ಅಂಡ್ ವೈಫ್ ನ ಎಕ್ಸ್ಚೇಂಜ್ ಮಾಡ್ಕೊಳ್ಳೋದು ಇವರು ಅವ್ರಿಗೆ ಇವ್ರಿಗೆ ಇವರು.
Yes, yes, yes.
ಸೊ ವೇರ್ ಈ ರೀತಿಯಾದಂತಹ ಏನೋ ಇನ್ ದ ಸೋ ಕಾಲ್ಡ್ ನಾವು ಈ ಕಲ್ಚರ್ ಕಾರ್ಪೊರೇಟ್ ಕಲ್ಚರ್ ಸೊ ಈ ರೀತಿಯಾದಂತಹ ಒಂದು ಹೆಸರಿನಲ್ಲಿ
ಹೌದು.
ನಾವು ಮಾಡ್ತಾ ಇರುವಂತಹ ಒಂದು ಈ ಆಚರಣೆಗಳು ಅಪ್ಕಮಿಂಗ್ ಜನರೇಷನ್ ಗೆ ಯಾವ ರೀತಿಯಾದಂತಹ ಒಂದು ಮಾದರಿ ಆಗತ್ತೆ. ಸೊ ಎಷ್ಟೋ ಬಾರಿ ನಾವು ಎಜುಕೇಟೆಡ್ ಸೋ ಕಾಲ್ಡ್ ಎಜುಕೇಟೆಡ್ ಪೀಪಲ್ ಆರ್ ಡೂಯಿಂಗ್ ಇಟ್. ಇಟ್ ಇಸ್ ನಾಟ್ ದಿ ಅನ್ಎಜುಕೇಟೆಡ್ ಪೀಪಲ್ ಆರ್ ಡೂಯಿಂಗ್ ಇಟ್, ಬಟ್ ಸೋ ಕಾಲ್ಡ್ ಎಜುಕೇಟೆಡ್ ಪೀಪಲ್ ಆರ್ ಡೂಯಿಂಗ್ ಇಟ್ as a practice.
Yes.
So it is not commitment between the husband and wife is confined to them. Yes. Since as we consider it as a secret. But ಇದು ಯಾವ ರೀತಿಯಾದಂತಹ ಟರ್ನ್ಸ್ ಅನ್ನ ತೆಗೆದುಕೊಳ್ಳಬಹುದು ಸೊಸೈಟಿಯಲ್ಲಿ, how it can impact on the concept of marriage and also to the lesson to the upcoming generation.
Yes, sir. Hey, an excellent question. I would not only add up this swapping, but every bad habit. If the parents or anybody in the family smokes or drinks in front of his child, same situation. When dad is drinking and my mom is doing something which is not socially acceptable, child feels is normal. So many times I always say, I'm very happy to treat villagers, innocent people, and they are always honest. They follow my advice, and tomorrow they come back and say more than 50% or more than 80% they are all right. And please tell me, sir, tomorrow what more? The educated people, sometimes we put it as a harsh word, educated idiots. They are dangerous people. In the name of education or high society, they are doing all the things that they are not supposed to do. It's very difficult, as you are aware, very, very difficult to stop them. Only yesterday I was being told by one of my colleagues, sir, what's the doctors go to the conferences and meetings, and the end of this there is always a cocktail party. What message it carries to the society, sir, if people come to know? So they come with wife and sometimes even with the children, if it's a place of some tourism, and tomorrow they want to go around. What message it carries? Yes, a bad thing is a bad thing, whether educated, uneducated, or a villager, or a whatever. So very difficult. We cannot just convince. No, occasionally. What's become now is, if you're not an alcoholic, if you're not a smoker, if you don't any of these vices, you are a useless idiot. That's the unfortunate thing. But definitely it's a bad thing. How far we can control that, how far we are able to do it, is a very big challenge. Definitely it creates a bad impression and a bad example to the younger generation. As a teacher, I would like to see that I'm a role model to the students. But if I'm not a role model, I'll be a rolling model. That's all. So rightly, as you said, it's a very big challenge, but somebody has to take a bold step. Somebody has to explain, say, this is the thing.
ಸರ್ ಈಗ ಯಾರು ಮಾಡ್ಬೇಕು ಅಂತ ಗೊತ್ತಿಲ್ಲ. ಯಾಕಂತಂದ್ರೆ ಈ ವಿಚಾರ ನಾನು ಹೇಳಿದ್ದು ಏನಕ್ಕೆ ನಾಟ್ ದಿ ಓನ್ಲಿ ಸ್ಮೋಕಿಂಗ್ ಅಂತಲ್ಲ, ವೈಫ್ ಸ್ವಾಪಿಂಗ್, ಗಂಡನನ್ನ ಬೇರೆ ಹೆಣ್ಣಿಗೆ ಗಂಡನನ್ನ ಒಪ್ಸುವಂತದ್ದು, ತನ್ನ ಹೆಂಡತಿ ತಾನು ಬೇರೆ ಗಂಡನಿಗೆ ಒಪ್ಸ್ಕೊಳ್ಳುವಂತದ್ದು. ಯಾವ ರೀತಿಯಾದಂತಹ ಕಲ್ಚರ್ ಅನ್ನ ಯಾವ ಮ್ಯಾನೇಜರ್ ಮಾಡಬೇಕು, ಯಾವ ಸಿಇಒ ಮಾಡಬೇಕು, ಯಾವ ಪ್ರೆಸಿಡೆಂಟ್ ಮಾಡಬೇಕು, ಯಾರ ಕಂಪನಿನ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದವರು ಇದಕ್ಕೆ ಒಂದು ಫುಲ್ ಸ್ಟಾಪ್ ಹಾಕಬೇಕು, ಅದು ಗೊತ್ತಿಲ್ಲ ನಮ್ಗೆ. ಸೊ ಬಟ್ ಈ ರೀತಿಯಾದಂತಹ ಕಲ್ಚರ್ ಇನ್ ದ ನೇಮ್ ಆಫ್ ಕಾರ್ಪೊರೇಟ್ ವೆಸ್ಟರ್ನೈಸೇಷನ್, ಸೊ ಇವುಗಳ ಹೆಸರಿನಲ್ಲಿ ನಡೀತಾ ಇರುವಂತದ್ದು ಒಂದು ಇಟ್ ಇಸ್ ಬ್ಯಾಡ್ ಟ್ರೆಂಡ್ ಅಂತಾನೆ ಹೇಳ್ಬೋದು. ಟ್ರೆಂಡ್ ಅಂತ ನಾವು ಹೇಳಿ ಕರಿತೀವಿ. ಟ್ರೆಂಡ್ ನಲ್ಲಿ ಎಲ್ಲಾ ಚಲ್ತಾ ಹೇ ಅನ್ನೋದು ಆಗೋಗ್ತಾ ಇದೆ ಹೊರತು, ಬಟ್ ಚಲ್ತಾ ಹೇ ಇಂದ ಯಾವ ರೀತಿಯಾದಂತಹ ರಿಪರ್ಕಷನ್ಸ್ ಇರುತ್ತೆ ಅನ್ನೋದನ್ನ ನಾವು ಪ್ರಾಬಲಿ ಸೂಕ್ಷ್ಮವಾಗಿ ಅನಲೈಸ್ ಮಾಡೋದ್ರಲ್ಲಿ ಫೇಲ್ ಆಗ್ತಿದೀವಿ ಅಂತ ಅನ್ನಿಸ್ತಾ ಇದೆ ಸರ್.
Bad may be a too simple a word, sir. It's the worst habit. So somebody has to build the cat, at least from our side. We have to. It may not be so easy to do it, but at least somebody has to raise the voice. At least maybe 1%, 0.1% may realize it's bad. When people of similar thinking, like thinking, join, maybe optimistically we may hope that it may come down, it may stop. That's the only thing we can do.
And also, ನೀವು ಒಂದು ಸ್ಲೈಡ್ ಅಲ್ಲಿ ಹೇಳಿದ್ರಿ ಸರ್, ಲವ್ ಫಸ್ಟ್ ಸೆಕ್ಸ್ ನೆಕ್ಸ್ಟ್ ಅಂತ ಹೇಳಿ, ಬಟ್ ಇನ್ನೊಂದು ಆಲ್ಸೋ ಕೆಳಗಡೆ ಇತ್ತು ಸೆಕ್ಸ್ ಫಸ್ಟ್ ಲವ್ ನೆಕ್ಸ್ಟ್ ಅಂತ ಹೇಳಿ. ಅಂಡ್ ಆಲ್ಸೋ ಡಾಕ್ಟರ್ ಮಾನಸ ಮೇಡಮ್ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಲಾಸ್ಟ್ ಸೆಷನ್ ಅಲ್ಲಿ ಕಾಂಟ್ರಾಸೆಪ್ಟಿವ್ ಪಿಲ್ಸ್ ಬಗ್ಗೆ ಹೇಳಿದ್ರು. ಸೊ ವಿ ಹ್ಯಾಡ್ ಸಮ್ ಸ್ಟಡಿ, ಏನು ಅಂತ ಹೇಳಿದ್ರೆ ಒಂದು ಪ್ರಿಲಿಮಿನರಿ ಸರ್ವೆ ಅನ್ನ ಮಾಡಿದೀವಿ ನಾವು. ಕಾಂಟ್ರಾಸೆಪ್ಟಿವ್ಸ್ ಕನ್ಸ್ಯೂಮರ್ಸ್ ಯಾರು ಅಂತ ಹೇಳಿದ್ರೆ ಇಟ್ ಇಸ್ ಆಲ್ಮೋಸ್ಟ್ ಆಲ್ ಈಗಿನ ಅಂಡರ್ ಗ್ರಾಜುಯೇಟ್, ಪೋಸ್ಟ್ ಗ್ರಾಜುಯೇಟ್ ಪ್ಲಸ್ ಹೈಸ್ಕೂಲಿನ ಮಕ್ಕಳು. ಹೈಸ್ಕೂಲಿನ ಮಕ್ಕಳು ಆರ್ ದಿ ಮೋರ್ ಕನ್ಸ್ಯೂಮರ್ ಆಫ್ ಕಾಂಟ್ರಾಸೆಪ್ಟಿವ್ಸ್ ಈಗಿನ.
UG-PGs ರೈಟ್ ಟು ಮ್ಯಾರೇಜ್ 18 to 21 ಆಗಿರುತ್ತೆ.
ಹೈಸ್ಕೂಲ್ ಮಕ್ಕಳು ಹೌದು ಕಾಂಟ್ರಾಸೆಪ್ಟಿವ್ ಯೂಸ್ ಮಾಡ್ತಿದ್ದಾರೆ ಸರ್.
ಒಂದ್ ಕಾಲದಲ್ಲಿ ಮೇ ಬಿ 30-40 years ಬ್ಯಾಕ್ ಅಮೆರಿಕಾದಲ್ಲೋ ಫಾರಿನ್ ಕಂಟ್ರೀಸ್ ಅಲ್ಲಿ ಯು ನಾಟ್ ಡೇಟೆಡ್ ಅಂದ್ಬಿಟ್ಟು ಹೈಸ್ಕೂಲ್ ಹುಡುಗರು ಕೇಳ್ತಿದ್ರಂತೆ. ಈಗ ದಟ್ಸ್ ವೋಟ್ ಐ ಕ್ಯಾನ್ ಬೈ ಅವರ್
ಇಂಡಿಯನ್ಸ್.
ಎಸ್, ನಾವು ಕೆಲಸ ಹೈಸ್ಕೂಲ್ಗೆ ಲೆಕ್ಚರ್ ಹೋದಾಗ ಕೆಲಸ ಬಹಳ ಪುಣ್ಯ ಕೇಳ್ತಾರೆ ಹುಡುಗರು. ಏನೋ ಹೇಳ್ತೀನಿ, ಏನೇ ಕನ್ಫ್ಯೂಷನ್ ಸರ್, ಹಾಗಾದ್ರೆ ನಮ್ಗೇನು ಆಗಲ್ವಾ ಸರ್ ಅಂತಾರೆ. ಏನಪ್ಪ ಆಗಲ್ಲ, ನೀವು ಹುಡುಗ ಬಂದ್ಬಿಟ್ಟು ಕೇಳ್ದ, ಮೊನ್ನೆ ಕೇಳ್ದ, ಹಿಂಗೆ ಏನಾಗುತ್ತೆ, ಏನೂ ಆಗಲ್ವ, ಯಾಕೆ ಏನಾಗುತ್ತೆ? ಹಂಗಲ್ಲ ಸರ್, ನೀವೇನೋ ಹೇಳಿದ್ರಿ. ಏನ್ ಹೇಳ್ದಪ್ಪ ನಾನು? ತುಂಬಾ ಹೇಳಿದ್ದೆ, ಹೇಳು ಅಂತಂದ್ರೆ ಈಸ್ ಟಾಕಿಂಗ್ ಅಬೌಟ್ ಸೆಕ್ಸ್. ನನ್ಗೇನು ಆಗಲ್ವಾ ಸರ್ ಅಂತಾನೆ. Talking about the girl becoming pregnant, one aspect, or getting the sexually transmitted diseases. So see the thing. Open ಕೇಳ್ತೆ ಅಂತ ಬಂದ್ಬಿಟ್ಟು ನನ್ನ ಹತ್ರ ಬಂದು ಅಷ್ಟು ಇದಾಗ್ಬಿಟ್ಟಿದೆ. ಸೊ ಎ ಪ್ರಾಪರ್ ಎಜುಕೇಶನ್ ಈಸ್ ರಿಯಲಿ ನೆಸೆಸರಿ ಟು ಪ್ರಿವೆಂಟ್ ಆಲ್ ದೀಸ್ ಬ್ಯಾಕ್ ಡೋರ್ ಎಂಟ್ರೀಸ್ ಅಂಡ್ ರಾಂಗ್ ರೂಟ್ಸ್. ಮಾಡಬೇಕು ಸರ್. ಏನೋ nobody everybody ಇದೆಯಲ್ಲ ಆ ತರ ಹೋಗ್ತಿದೆ. ಬಟ್ somehow whether they like us or not, whether they follow our this thing, we have to do it. ಇಬ್ರು ಸೇರಿ ಆಮೇಲೆ 20 ಜನ ಆಗ್ತಾರೆ. At least they feel somebody is against this system. Otherwise ಸುಮ್ಮನೆ ಕೂತ್ರೆ ಮೌನ ಸಮ್ಮತಿ ಲಕ್ಷಣ ಆಗುತ್ತೆ ಅಲ್ವಾ? ಹಾಗಾಗುತ್ತೆ ಸರ್. ವೆರಿ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಥ್ಯಾಂಕ್ ಯು ಸರ್. So hope many of the things clarified. Many of the new questions have been opened up by me. Thank you again. Anything from my side you would like to discuss, I'm always available, and you can always call me anytime. Only except 2 situations when I'm taking a class or a lecture, or when I'm driving a car, I may not be able to answer. Otherwise, thank you so much for your patience.